center. And then gently push down into my hand like you're trying to bring your leg back down to the table. Good. Hold back.
So are you just
How's that feeling now? It's the same pressure as before?
No, it's a little better.
What number would you give that?
It was a 4, maybe a 3.
Alright, not a whole lot less.
Yeah.
So let's try this way. Let's take it back to about a 5, 4, 5. About there. Nice and relaxed. Better, worse, same?
Better.
Okay, what number would you give it?
Oh, like a 2.
Okay. About now.
It's fine now.
Okay. So trying a couple different things to release it. The first thing I was doing was holding a trigger point and having her do. You guys familiar with reciprocal inhibition? No?
Activate the opposite muscle group.
Yeah. So if you activate the opposite muscle group neurologically, it'll shut down the dysfunctional muscle. So we've got a tight hip flexor. While I was holding a trigger point on her TFL, I was having her do hip extension, which is the exact opposite. So kind of trying to shut that muscle down from a couple different angles. And then now we're essentially doing some strain, counter strain, or positional release therapy. How's it feeling now?
Better.
Okay.
It made my stomach start growling.
No,
Stomach
it didn't.
Weird.
It did not. It's just because it's 11:10, right? Right?
Magic.
Right? There. So it's feeling softer. Well, let's retest it. How do I test the TFL? Flexion, abduction, and internal rotation. Okay, hold there. I'm going to push down and in. Oh, very nice. And relax. Don't know how it compares to the other side, but definitely it had more ability to resist than the other side. Okay. Again, you know, what specifically is driving that? You may look at knees, ankles, low back, because that TFL plays a role in all of those areas, right? It's a hip flexor, so if it gets really tight, it can contribute to an anterior tilt to the pelvis, which can be related to low back pain. We know that the IT band plays a role in the knee. The knee is connected to the foot and ankle. But again, her symptoms are vague enough that it's probably not something I would spend a lot of time tracking down unless it was really bothering her.
Yeah, it hasn't bothered me. But obviously something's wrong.
Something's going on, yeah. Just out of curiosity, let's see what the TFL feels like on this side. Tender as well, yeah. So a little bilateral TFL issue, all right? So I would have you experiment with foam rolling this or on something similar, right? So not quite directly anterior, not quite lateral, but halfway in between. See if releasing that muscle at least helps with the clicking. Now it may help with the clicking, but it might allow for a little bit more mobility or relative instability in the hip joint. Again, maybe that TFL's trying to hold the hip joint together. So symptomatic relief, can we relax the TFL? Does it fix the issue? Probably not. Okay.
Would you want to relax the muscle and then have them strengthen? So then the stronger the muscle, the more stable.
Right. It gets tricky because part of what might be causing the clicking is the fact that it's too tight, so you got to be cautious with strengthening it because that might tighten it again if the other muscles are not jumping in the way that they should be. So I would first just try and work on relaxing it, see if that doesn't help, and then maybe look a little bit more. Again, nothing else really came up much on the resisted muscle test. It doesn't seem like any other muscle is kind of out to lunch, and that's why TFL's jumping in and doing extra work. So sometimes it needs to relax, right? But again, I would look at it more from where else could that need for the tightness be coming from, as opposed to an actual weakness per se.